Hello, good evening. Dr. Chide Ufundu of Snowspirations Global Health Solutions. How are you? Thank you and welcome to our episode of Open Clinic with Dr. Chide on YouTube. Today's topic is a topic that every singular person in our community should be conversant with. Today we're talking about the ovaries and ovarian reserve and the process of ovulation. This is at the center of everything becoming pregnant. So we're talking about 5 major facts about everything you need to know of your ovaries, your ovarian reserve, and ability to become pregnant. So it's going to be interesting. And I need you to quickly settle in, announce your name, tell us where you're located. Then, as soon as possible, we're going to start, and you're going to remember a lot of good things about today. So, thank you so much, Dr. Chidi Ufundu, and I'm going to start very, very, very soon. Today, we're looking at 5 major facts about your ovaries, about ovarian reserve, and your ability to achieve pregnancy. I'm going to keep it real. I understand it's a topic that so many people don't want to talk about, but we cannot afford to allow ignorance to deprive us, to rob us of our ability to become parents. So let's actually start. You see, every singular person in the clinic today who is a woman has 2 ovaries. Now, your ovaries are the most important component of your reproductive system. So long as you have your ovaries and they are functional, you can birth your own child biologically. Now, something can happen to the vagina, that's fine. Something can happen to the cervix, that's okay. Something can happen to the womb, no biggie. Something can happen to the tubes, we fine. But if anything happens to the ovaries, you are compromised regarding your own originality. So the ovaries are the 2 important organs in the body of a woman. Now, when you were conceived in your mother's womb and you became a girl, you already have your ovaries set out for you. Now, the important thing you have to understand about this structure is the fact that this is where your family starts. You are by default the product of your grandmother's ovary. So every singular member of your family resides in the ovary. So the ovary is where the eggs are harbored in immature phase from your womb. So this is where all the eggs, as a baby inside your mother's womb, you have about millions of eggs. But over the lifespan of your fertility years, you should have about 400 of those eggs released, which will now participate in the process of making babies. So the very first fact you have to understand about the ovaries is the fact that this is where the eggs are stored. They are stored in immature phase. When you cross puberty, when you activate the process of having babies, that's when you get to puberty and you begin to bleed. Now, those eggs will be released every month. So you have immature phase, then every month one egg will be matured, and there's a vehicle that the egg will be contained on the inside, which is called the follicles. So this is number 1 fact. This is one of the most important things you have to learn in all the clinics I've been teaching you guys. Once the eggs are released within that particular phase, which we call ovulation, they will travel and wait for the sperm in a special place in the tube called the ampulla. By the grace of God, the sperm will come in and make the eggs, then fertilization will occur. So if anything happens to the ovaries and the ovaries are not performing its role, then fertilization will not occur because the eggs will not be released, the eggs will not be matured. So everything about the ovary must be standard. Thankfully, God gave women 2 ovaries. So if anything happens to this side and this side is still healthy, you can still have all your families with 1 healthy ovary. The problem is when both of them are affected, then you've practically gone into menopause. But so long as you have your ovaries, you can have surrogacy. So if anything happens to other structures in your body, but your eggs are still there, you can still use your eggs and another woman can bear your baby. It's called surrogacy. So this is number one fact about the ovaries, about the eggs, and the process of fertilization. So it's expected majority of women will release that egg that is contained in the ovaries every 28 days. So 28 days is the regular cycle in a woman. So number two fact about the ovaries, besides harboring the eggs, besides having the immature phase and allowing it to mature, the ovaries also produce two important hormones, estrogen and progesterone. Estrogen and progesterone is what makes you a woman, is what makes you a mother. So these two hormones are what maintains the menstrual cycle, the ovulation, the breastfeeding. So the ovaries produce estrogen, which is the major hormone responsible for development of all the female reproductive system. Without estrogen, you're not a woman. This is the reason why you're getting older. When your estrogen level begins to fall, you begin to experience menopause. So once estrogen level is reducing in your body, you are no longer going to be the woman that God made you to be. So number one important hormone that is produced in the ovaries is what? Estrogen. Number two, progesterone. Progesterone is the pregnancy maintaining hormone. Progesterone will also play a role in milk production and a couple of other beautiful things. Number one, for you to have successful pregnancy, the cover of your womb must be thick enough. That's called the endometrium. Progesterone and estrogen will make sure that the cover of the womb is thick enough. If the cover of your womb is not thick enough, you're likely going to have miscarriage or pregnancy will not happen at all. So number two fact is the fact that these two major hormones are deposited and produced in the ovaries. Very important. Now, number three fact, throughout a woman's lifetime, she will have about 300 and 400 of the millions of the eggs which God gave you. 300 to 400 will participate in starting your family. So 300 to 400 eggs is the average of the eggs you will make available so that the sperm will fertilize them. It's not all the eggs that will be viable. So imagine those millions. What happened to those millions? Over time, so many of them will die off. So many of them will just be losing them because the body wants the best. But in the lifetime of a woman who wants to have a baby, before she enters menopause, you have an average of 300 to 400 of those eggs which you use to start your family. Now, let's ask us a very simple question. Imagine if you had all the babies in your ovaries. So imagine if every woman is having 400 eggs. Because imagine the chaos. So life is perfect the way God planned it. Now, number four, unfortunately, or we can't query God. Now, a woman is like a flower. I keep saying this, and I don't know how else to say this so you understand it. You are not gonna always have the eggs you have as you're aging. Unfortunately, as you're aging, your eggs, your ovaries are gonna be aging. You'll be losing the eggs, both in the quantity and quality, and the ovaries are gonna start reducing its function. So as a woman ages, so does the ovaries and the eggs. By the time you get to puberty, out of the millions of the eggs you already have, you will be left with about 400,000. So now when you get to age 35, that's the cutoff point. Once a woman gets to age 35, she has graduated into advanced maternal age. Now, my people, I know so many people worry about this when I talk about them. They talk about anxiety. Doc, why are you putting fear in us? My sister, let me ask you a simple question. Will you rather I confuse you? Will you rather I allow you to be in comfort zone without knowing the knowledge of what you need to do to become a mother? So many people would have become mothers and grandmothers today if they have the knowledge they have today. So my sister, I understand the anxiety that you're single. I understand the anxiety you don't have a baby, and you don't want me to talk about this, but this is very important. Now, another fact you have to understand is the concept of ovarian reserve test. So every woman having infertility, the most important test you need to go and run is what? Ovarian reserve test. Ovarian reserve test will tell us the likelihood of the numerical strength of the remaining number of eggs you have. So it's an estimate. It's more like an assessment. And there is an important hormone we'll normally check to give us an idea. It's called anti-Mullerian hormone. So if we collect your blood and we check the level of your anti-Mullerian hormone, if it's high and within the normal range, we are encouraged. But if your AMH is low, the possibility you're gradually going into menopause is very high. This is a factor you need to understand. We wouldn't want a woman that her AMH is completely gone and she's still going to places that will confuse her. So it's important to understand the concept of ovarian reserve test. Now, as you are going in life, you're getting old, there are so many changes that will happen to the ovaries over time. The follicles will keep being released. So there is a major follicle that will contain the egg. Once the follicle releases the egg, it's gonna collapse and form what we call corpus luteum, which will also support the process of pregnancy if pregnancy were to happen. So as a woman is going through puberty, there are so many changes that happen in the body of the ovaries. There are so many changes that happen to the follicles. There are so many changes that happen to the egg. Now, by the time you are done using all the eggs you have, you will gradually enter menopause. When you enter menopause, what happens? You no longer have eggs. You have used all your eggs. Can you still be a mother when you enter menopause? Yes. What do you need? Someone else's egg. So these are facts you need to have in your fingertips so that if you are having infertility, so if you meet your partner, so if you meet a doctor, you can have meaningful conversation with them. You can tell them to tell you your reality. You see, unfortunately, so many women show up every day, every year. They keep going back to the same people and they keep deceiving them. Nobody is telling you the truth. It doesn't make sense. I will not like myself if I come in here and I confuse you guys. You have to understand you're a flower. So you have your morning, you have your afternoon, you have your evening. What you need is to use the knowledge you have now at the age where you find yourself and activate the cascade and become a mother. There are some women that might be in their 50s and by next year they will become mothers. Why? Because they acted on the knowledge they have today. So if a woman is presenting and a woman met her partner at age 50, what does she need to do? Immediately go for IVF with donor eggs without wasting time. So a woman can actually be 50, meet her partner when at 50, and by next day she can have 4 kids. So it's what you do with the information we share that matter. Then a woman can marry at age 25, and for the last 20 years, she's jumping from one place to the other, and they are deceiving you. There are so many people that are willing to deceive you and delay you, but we do not have the liberty of delaying anybody in this group. Okay, so that's my presentation, and I'm gonna quickly open the floor and allow us to ask our question. And who else is in the clinic today, if not my amazing COO, Kene and Tosi? 2 amazing people, 2 regular, come rain, come hurricane, come whatever, you will find these 2 amazing ladies in the clinic. Now, Sada, thank you and welcome. So, guys, ask your questions in real time. Let's get cracking. Immediately after this clinic, I'm going to go to our Facebook page to give this same lecture. So join us in our Facebook group if you don't have access to our YouTube. So immediately after this, I'm going to go to Facebook and we continue the conversation. If you have not subscribed, please use this opportunity to subscribe, like, comment, share, tell people about this group. Everything is completely free. The idea is to help you to know your body better so you can take over and defeat infertility. Amara Ugudike, thank you so much. So guys, please ask your questions, please. Ask questions, okay? Tosi, evening, doc. Is it possible for a woman to be born without ovaries? Unfortunately, yes. Let me tell you the truth. Anytime you wake up, thank God first for giving you life. There are so many people going through a lot. So there are things we call congenital problems. There are some women that will be born without the whole reproductive system. Everything is completely missing. There are some women that will be born with double womb. There are some women that will be born with uniform womb, abnormal womb. There are some women that will be born without tubes. There are some women that will be born without a vagina. So the answer is yes. They are rare, but it can happen. Now, it's happening to people not because they did anything, but that's life. So there are so many things we have, we don't appreciate. Then there are so many things that people are looking for. There are some women that are born without womb. There are some women that are born without tubes. There are some women that are born without cervix. There are some women that are born without vagina. There are some women that are born without some of the organs, not because they did anything wrong. So if you have your organs intact, if you have your vagina, your cervix, your womb, your tubes, your ovaries, your eggs, thank God. It means you have a chance. It means the blessings are going to come. So the answer is yes, unfortunately. Okay, now I'm not going to discuss numbers regarding AMH. What I will tell you is go to your location, Different labs have their different values, but keep an eye on the number in bracket. I don't like discussing lab values because it can be confusing, but remember, don't take yourself to the lab. Your provider will request the lab you need. Then when the result comes out, take it to your provider. But keep your eyes on the numbers in the bracket. Let me give you an example. If the lab you're using has a range of 6 to 20, so 6 is the lower limit of normal and 20 is the upper limit of normal, and you have your AMH and your AMH gives you 12. Is 12 contained in 6 to 20? Yes. So if your value is 12, it means you're normal, right? Now, if your value is 4 and the lower limit is 6, is 4 bigger than 6? No, 4 is smaller than 6. So if you have AMH of 4, whereas the value for the lab is giving you 6 to 20, it means your AMH is low, and the interpretation is simply the fact that you are likely getting ready to enter menopause. Very important. Doc, are there signs of poor egg quality and what can be done? Unfortunately, sometimes you don't know unless you go seeking for them. So there is no classical presentation of women that have reduced ovarian reserve. Some women might present with some clinical signs. So they might present with, definitely fertility can be, a telltale sign. You probably, abnormalities in your bleeding and dry vagina, hot flushes. So there is no telltale sign. This is why you need to go for further investigation. So if you are believing God for a baby and you are 35 years and above, and you have been believing God the right way, that means you're making love 48 hourly, you're praying, you're doing everything right. And after 6 months, if you don't have a positive pregnancy test, then you begin to go for investigations. So what of investigations will normally run, which I told you guys is the most important one, your anti-malarial hormone. Every singular woman in this community, if you are believing God for a baby and you have not done your ovarian reserve test, you have not started. Because your ovarian reserve test will tell us what we need to do. So if you check your ovarian reserve test and we are convinced you're not going to have your own baby unless you go for donor X, we're going to advise you properly. If you check your ovarian reserve test and we are worried that if you keep waiting for the natural things to happen, it will not happen, we can do super ovulation. We can collect all your eggs. We can freeze some of them. Then we can begin the process of assisted reproductive technique. So ovarian reserve test is the most important test, because if we don't do the tubes, you can still become pregnant without your tubes. If anything happens to the womb, you can still go for surrogacy. But if you no longer have eggs, how can you be going for something when something is not there? So very, very important. Okay, Kate, what can stop a matured egg from releasing? Now, a couple of things. Number one, hormonal imbalance, inflammation, some other disease condition. But top on the list is hormonal imbalance. By default, if all the reproductive hormones in your body play their role, I'm going to give you the different functions. Estrogen is what makes you a woman. So remember the role of estrogen and progesterone to prepare the whole reproductive system, especially making sure that the endometrium is good. Now, there's another hormone that plays a critical role, or you don't mess with this hormone. It's called LH hormone, luteinizing hormone. LH in my language is called otimpu. So otimpu is like the town crier. So LH hormone is the hormone that will tell the whole body, hey, everybody prepare the kingdom, the egg is about to come. LH hormone is what you check when you're checking your ovulation test kit. Once you have an LH surge, then ovulation will happen by the grace of God. Now, there's another important hormone we call FSH, follicular stimulating hormone. This is the hormone that will go to the ovaries and tell the ovaries, hey, it's that time of the month. Please start preparing that queen, that one ovum, that one egg. So when your FSH stimulates the egg, which was sleeping, which is an immature phase, the eggs will start growing into dominant matured egg inside the follicle. By the time the LH goes up, the egg will be released through the process of ovulation. So you can see they all have critical roles they play. So if anything happens in those pathways, then we begin to have problems. Okay, so if anything happens to all these critical hormone that should play a role, then some women might have unruptured eggs. So there are some women that actually have eggs, but for some reason it's not rupturing. When you have this problem, we still have to give you fertility treatment. Okay, what can stop? Okay, I've already answered that. What causes ovaries to fail? What do you mean by that, Mother? Now, naturally, when you enter menopause, your ovaries will cease to function. Now, some women can have premature ovarian failure. Sometimes we don't know. Sometimes it might be infection. Sometimes it might be inflammation. Sometimes it might be exposure to chemicals in your environment. Sometimes it's just pretty genetic. So there are some women that will enter menopause before 40. Any woman that enters menopause before 40 is classified as having what? Premature ovarian failure, or premature ovarian insufficiency, or premature menopause. You are ordinarily supposed to be thinking about menopause from the age of 50. But if your own happens before 40, it's premature. So you need to know all this. Okay? Common type of issues with ovary that can affect male fertility. A whole lot. Number one on the list, you can't forget this. Polycystic ovarian syndrome. When you have polycystic ovarian syndrome, is the chief. What happens? For some reason, this syndrome goes to the ovaries and messes the whole architecture up. So you have poly. Poly means a lot. Cystic means abnormal structures of the follicles in your ovaries. When this happens, it begins to affect the ovulation, which ordinarily should have. So at the center of polycystic ovarian syndrome is lack of ovulation. There are so many women that will have this condition. If we don't identify it and we treat it professionally, you might end up not becoming a mother. So the biggest elephant in the room regarding ovulatory disorder is polycystic ovarian syndrome. But anything that affects the functionality of your ovaries will definitely affect the function. So if you have a condition we call endometriosis of the ovaries, where it will go and distort the whole architecture, you will have a condition we call endometrioma. So endometriosis of the ovaries is called endometrioma, and anywhere you see endometrial cells, abnormal endometrial cells, it will go there and damage the whole architecture. So anything whatsoever that affects the normal functioning of the ovaries can lead to problems. So if you have hormonal imbalance, like all these hormones I mentioned, if one of them goes up or go down beyond the expected range, then you begin to have problems. Your body weight can also lead to abnormal weight. So if you are underweight, or if you're overweight, or if you have obesity, it can affect your ability to perform the role that the ovaries ordinarily should perform. Can contraceptives affect the ovaries? 100%. Now, if you use contraceptives accordingly, they are supposed to temporarily, cause an imbalance in the function of the hormones produced by the ovaries. Remember, the two major hormones in the ovaries can be flipped. The same hormone we use in achieving pregnancy can be used to stop pregnancy. So all the pills, virtually 99% of the contraceptives you use out there, oral contraceptives, they are artificial products of estrogen and progesterone. So depending on the quantity we give you and how we give you that, it can achieve preventing pregnancy from happening or allowing pregnancy to happen. This is why you need to be careful. So when you begin to take your Clomid by yourself, you might actually be hurting yourself when you think you're helping yourself. So never take any hormonal drug by yourself. Make sure it's monitored. So most women that take Clomid ordinarily are supposed to take Clomid within 5 days. But when you begin to take Clomid beyond the time you're supposed to take it, it can go and cause a lot of disruption and can damage your ovaries. Now, external things, chemicals, cancers, infections can damage your ovaries. When it damages your ovaries, it's going to affect the function of the ovaries. And if it affects the function of the ovaries, you're not going to be able to become pregnant. Okay? Definitely alcohol. Alcohol is a very big enemy. There is actually no good thing that alcohol does in the body. So anybody telling you C and B about alcohol is deceiving you. Alcohol until today is still an enemy to infertility. So alcohol can indirectly affect your ovarian reserve. Remember, your ovarian reserve by nature, by default, will deplete. But when you indulge in poor lifestyle, they can predispose you to having problems that will lead to more depletion. So smoking, alcohol, lack of exercise, stress, and all that can all culminate in affecting the natural function of your ovaries, which ultimately will lead to problem in your reserve. Reserve is talking about the quantity and quality. Very, very important. Okay, now when we talk about premature ovarian failure, it means for some reason, for some strange reasons, it can be genetic, it can be acquired, your ovaries packed up before 40. And when your ovaries packed up, it means you have gone into menopause. So any woman, unfortunately, you're having infertility, and we run your ovarian reserve, and your AMH is badly, badly depleted, we have to start thinking in line with primary ovarian insufficiency, primary ovarian failure or premature ovarian failure, any which one you call them, they are the same thing. So if it happens before 40, you are classified in that premature ovarian failure. When your ovary fails, your ovaries will no longer perform it so. So it can be a couple of other things. Sometimes we don't know. Sometimes it might be autoimmune. So autoimmune means there is something in your body fighting your body. Sometimes it might be lifestyle. Sometimes it might be chemicals. Sometimes it might be cancer. Sometimes it can be a whole lot of infections, inflammations. So we need to really dig in deeper to know why when you have this. Now, do we have alternatives? Yes. If we notice that a woman is having premature ovarian failure, then we have to intervene. What do? We begin to think about assisted reproductive technique. So if it's completely no, if you have 0 eggs, then we need to start thinking about using donor eggs to prime your body and still get you pregnant. So what we will do in regards to managing a particular thing is based on that type of condition you have. So the answer is yes. Okay, guys, we have 2 more minutes. 2 more minutes. Ask your question so we can go and continue the conversation in our Facebook. Hold on, let me see. Okay, here we go. It's working now. So guys, keep asking me questions, okay? Where is the location of the ovaries in a woman's body? Look at this lady. Come on. So all the important reproductive organs are located in the pelvic area. Pelvic. So you know where your bikini line is, right? Okay, let me guide you. You see your belly button? Look down on your belly button. At that point where you will notice as a woman you have hairs, that area where the hairs grow is called the mum pubis. Now, if you imagine that this is the vagina, if you imagine that this is the vagina, you can begin to imagine the locations of all this. So if you see the location of the ovaries, so they are like branches, branching out, 2 of them, just by the pelvis. That's the most important area in the body of a woman. So I want you to imagine. The position of your vagina. I'm talking about the vagina, not the vulva. Vulva is what you see. So the part of the female reproductive organs you can see. So you can see the clitoris, you can see the labia minora, you can see the labia majora. They are the vulva. The vagina is the cylindrical opening, which is pinkish, right? Now position yourself where you have your vagina. Then begin to imagine where the cervix is. Then begin to imagine the bifurcation. So it's just like this, around that pubic bone axis. I'm not going to confuse you with all those anatomical terminologies, but just know this. Every organ that reproduces, every organ that participates in the process of making a baby is located in the pelvic region of a woman. Okay? You have to go back to medical school. I don't know what you're doing in this engineering. You are a doctor until proven otherwise. Guys, please keep asking questions. Please keep asking questions. We still have about 3 minutes. Remember, after this, please join our Facebook. We have a bigger community in Facebook, so join our page. And I just want to say this. August was challenging for so many reasons. I don't know, but we are still standing. Guess what? So if you're standing, thank God. If you're not begun, thank God. We have next 24 hours to enter September. Now, I want you to commit yourself with me. Promise yourself you will no longer do things that didn't yield results in August. Promise yourself that as we are entering September, which is countdown, once you begin to find ember in any month, it's naduma. Naduma in my language is bye-bye. So if you still want to become pregnant, if you still want to become a mother in 2023, it can still happen in September. But please don't make mistake of allowing it get to November, because once it gets to November, you begin to regret things you didn't do since January. So you still have time. We are now battling with 4 months. By the time we enter September, we have October, November. That's final. Our aim is to make sure that all the women that want to become mothers, at least by 31st December 2022, you are pregnant in your first trimester. Okay? Correct. Now, as you are growing old, definitely your ovaries will be shrinking in size. All the organs in the body of a woman, as you are getting old, you will notice they will start atrophying. Atrophy means they will start reducing the number of cells and the size. So if you pay attention to yourself, pay attention to your body. As you're getting older, you will notice that the dense tissues in your breast will be reducing. So you notice that your breast will start shrinking. It's no longer going to be fuller. You also notice that in your vaginal area, you notice that those fatty tissues in your mom pubis, you will notice they will start shrinking. You will notice some gray hairs around your vaginal heads. You notice some visible difference. In the same vein, as you're getting older, all the cells in the body will start shrinking. Unfortunately or fortunately, there are some cells in the body that as you're getting older, they will start getting bigger, like your nose and your ears. But all the organs around the male reproductive system, including the male and the female, as you're getting older, they will begin to reduce in size. So your ovaries will reduce as you're getting older. Okay? Can you please explain how to calculate when you are ovulating? Okay. So this is like our national anthem. I don't know if you have that calculation of your chioma. So what you need, my sister, to calculate your ovulation, two things. You need to know your cycle. How do you know your cycle? I want you to go and bring a plain paper. In that plain paper, you number January to December. Okay? Now, when you go to January, you mark the first day you bled in January. Put it in red. Now, count the number of days you will bleed. If you can get an average of 2 days or maximum of 7 days is normal. Now, count, assuming you started bleeding on the 9th of January and you stop bleeding on the 15th. You mark 9th and 15th. You go to February, you do the same. Now, when you find the average, when you find the difference between when you bled in January and when you bled in February, the number of days between them is called your cycle. So the regular cycle is 28 days. Now, if you notice that that pattern is consistent, you apply your factor 14. Now, the regular cycle in a woman is from 22 to 35 days. Now, if you apply the factor 14, so assuming you're bleeding every 28 days, and we apply factor 14, so what do you mean by applying factor 14? If we minus 14 from 28, we'll have 14 days. So if you start counting 14 days from the first day you bled, on the 14th day is the day you will likely bleed. Sorry, the day you will likely ovulate. So what you need to calculate your ovulation, if you are having regular predictive cycle, it's not every woman that can predict her cycle. There's some women, 3 months, they have not ovulated, 3 months, they have not bled, especially if you're getting older or if you just recently started. So at the two extremes of ages, women are going to have irregularities. So when your daughter will start bleeding, you will think every month your daughter will come and complain to you, Mommy, I'm bleeding. No, some will bleed every 6 months, some will bleed every 3 months until they find their balance. Now, as you're getting older, you'll notice that after 3 months, you haven't bled, 4 months, before you know it, 6 months, before you know it, 12 months. If you have not bled for 12 months, you have gone into menopause. So one of the classical presentation of menopause is absence of your bleeding for 12 months. So you need to know, you need to study your body. Every woman in this community, you need to find time and study your body. When you study your body, you know when things are normal and when things are going wrong. That's how you know. Correct. It's too long to post. So Busola, you can join our Facebook right away, and we're going to share how to calculate your ovulation. But this is exactly the rudiments. Okay, guys, thank you so much for coming. Remember to hit like, remember to comment, remember to share, and remember to subscribe. Very important. We love you guys, and the next clinic will be on Saturdays. So Saturdays are a little bit early. So as we are getting ready for September, promise yourself that it's going to be a September to remember. I'll see you guys in Facebook. Thank you and have a good evening. Bye-bye for now.